medical surplus recovery since 1993. For every $1 we raise, we're able to distribute about $37 worth of medical surplus to clinics and hospitals locally, nationally, and around the world. We're located in North Orange County, and each week we receive about 40 pallets of medical surplus valued at over $300,000 wholesale. Now you might be wondering, what is medical surplus? Well, it's syringes with damaged packaging or a blood pressure monitor that gets retired for a newer version. Very recently, it was a mobile medical clinic that just wasn't being used. In-kind donors like AmerisourceBergen and Kaiser don't want to see these valuable resources wasted in our limited landfill space. Instead, they trust us to redistribute them to qualified communities. Today, I want to share with you our plans at community requests to utilize that donated clinic to provide hope to communities right here in Los Angeles. This past summer, the healthcare needs of LA were headline news with a medical outreach event to the Forum. Since the closure of hospitals like Martin Luther King, Downey Regional Hospital has seen a 33% rise in ER cases, most of which are non-urgent. I totally forgot what I'm going to say. Patients are coming from Compton and Huntington Park, among other communities, due to lack of access in their own. Working moms like Lynn come into the ER because she can't afford Tylenol for her baby. These communities have the highest number of youth and the least access to health care across the county, but today you can do something to provide hope to moms like Lynn. We have established a partnership with Western University and Downey Regional Medical to not only provide the medical personnel to operate the clinic, but to do the community outreach. Giving Children Hope will keep it stocked with needed supplies and medicines. We believe that this collaboration will reduce the number of expensive and unnecessary ER visits, and with that $1 to $37 ratio, provide the most effective and efficient way to meet these basic community needs. To get our clinic on the road, we need $250,000, $25,000 in refurbishment, and $225,000 for 1 year's operating expenses in 2010. We estimate being able to treat 12,000 patients, 10,000 in LA alone, which is under $18 per patient. In addition to funding, I seek new connections for pharmaceutical and equipment donations. Ladies and gentlemen, LA's healthcare is in crisis. Please join us to save lives and give children hope.
You have 5 seconds spare.
You mentioned the clinic a couple times. Every time you mention it, say mobile clinic, so that I know you're talking about the same thing.
Yeah.
So every time say mobile clinic, and presentation was improved like everybody's today, which just shows you how it's continual improvement and what you got to deal with next week. But also, I really liked how you finished with the name of your organization and tied it to what you're doing. So, one of the challenges is with some of the names, it's like exactly how's it tied to a mobile clinic? It helped make that connection.
And I think that was the line you forgot was, let me tell you more about this mobile clinic. I think that was the part that will be there next week.
Or not.
I have a little tweak to that. I mean, it's kind of like we've been receiving all the surplus, and out of the blue, instead of getting a box of syringes, we got this entire mobile clinic. Put some emotion into that little piece and say, whoa! Now this is an opportunity waiting to happen.
Yeah.
Now we are getting into an additional side of business to operate the clinic. You kind of subtly make me think, you said, well,
Yeah.
and then I catch up, oh yeah, the clinic is sitting there in the backyard. A syringe is sitting, a clinic is sitting in my backyard. What can we do with it? Throw it away. Well, connect me with some excitement. Look, the thing falls from heaven, an entire freaking clinic. You must make the emotional connection, and then from that point forward, it's no longer damaged syringes that I'm talking about, that you're talking about, but operating a clinic. And the first one was, why did we get the clinic? But the presentation is, what are we going to do with the clinic now that it fell from heaven?
I say we let Richard do all 10 presentations.
No.
Very good, very good.
I thought it was infinitely clear
expenses. What are those? Are those operating expenses things that you are going to provide? In other words, is that where you get the $1 to $37 leverage kind of things, syringes and stuff like
Well,
that?
it certainly is stocking it. Some of the medicines we're gonna have to actually purchase, because if I can get them donated, it'll reduce our operation expenses, but at this point, I can't get all the medicines that are gonna be needed to make the clinic effective. It's also staffing, insurance, maintenance, all of those good things.
And are the other partners responsible for some of that?
Well, they're responsible for the medical personnel staffing, but you still need a coordinator with the driver to take care of all the things that need to be done on a mobile clinic.
Yeah, one thing I guess I've never really exactly got is I know you say the patients are treated, you say there's 12,000, that's what you're aiming for. Like, what exactly are they going to get, you know, all right? And I guess somewhat related to that is I always think of getting these donations of, like you said, like syringes or whatever, and then I think, well, what happens when you run out of those and then you need to give someone an injection of something? You know, does that mean you go buy more, or I don't know. I mean, again, you know, we were 1 week before, but just something I've never quite got, you know, how that works. So maybe it's more that you guys are just now like a full force clinic and leverage in-kind donations as much as possible.
Yeah, and this certainly is new for us, so we're gonna, you know, figure it out as we move forward. But certainly on the supply end, you know, I mentioned we get about 40 pallets a week. That has been consistent. We've been around for 16 years, so anything can happen when you're dealing in a nonprofit and you're working on donations. I mean, could that change? It could. It hasn't. But, you know.
That's great.
I just happen to know because you and I had a private conversation about your space, which is 43,000 square feet
Yes.
of warehousing and administrative offices.
And I had that at one point and I dropped it.
I mean,
I don't think you
Is
know.
that helpful?
that's just a
Not-
thing that kind of was.
No,
amazing to me.
no.
Save it for the reception afterwards.
Yeah.
But I think your ability, the organization's ability to flex when something is dropped from heaven and you're able to just grab it and run with it and do something amazing it resonated with me today, where not so much last week.
Couple more?
Over here.
You're in charge. Point of something. So I didn't see it last week. I was confused today. So I blame my lack of attention, but I was sort of going down your path of you got all these syringes and stuff, and then this thing comes in, and then I missed we're not looking for funding for our current thing. This is a whole special project of Pitch USC. I don't know, but a pause or a little bit more of maybe explicit statement. We're not raising money for what we've been doing. This is a special project. You might have said that. I just missed it, and so it just went over me. And second, is this mobile clinic for kids only? Or is that just in the name, giving children hope? Okay.
That's our name. I could explain our name, but I don't have the time, so.
Yeah, okay, but I at least would make it extra clear.
You guys, when I
Because to me, a
started
special,
there,
we're established, startup in my world. Established starting around 16 years, but now we have a special project. We need funding for it. You got credibility. You've been doing something, but we need special funding. We have the expertise. We need money, and that's a pretty strong appeal to me as a venture capitalist.
I'd like to piggyback on that too, because at the very end of your pitch, when you're talking about, when you're doing the ask and you talk about the $250,000, one of the things that you talk about is I'm also, you made some comment, like, I'm also seeking new connections for donations. And to me, yeah, well, to me, that we're on the clinic, we're talking about the mobile clinic, and then all of a sudden, you send me back over here to your other business and want new connections for that. I'm not, that sends my mind in a different direction rather than keeping me focused on the clinic. I'm here to talk about the clinic, and I'm here to ask for stuff for the clinic, so.
Is that wrong with the clinic though? That's medicines for sure.
Yeah, I mean, if
Would
it's
lower my
for the
operating
clinic,
costs.
you know.
Yeah, there you go.
Just make sure, I guess what I'm